Central Engagement Team. And with me today, I have Jenny and Sarah working in the background, making sure that everyone gets into the meeting, and they'll keep an eye on other things as well for us. We'll do some other introductions shortly. So this vaccination program update is, as you know, aimed for sort of faith leaders, community champions and voluntary sectors. And it follows on from the series of webinars that were held earlier this year, just to give you an update and so forth. So for housekeeping, just to make sure that the sound quality is good for everyone, do keep yourself on mute while you are listening to the presenters. We are going to run through the presentation initially at the start. There will be a Q&A, so questions and answer session at the end. If you do have questions that come up while the presenters are speaking, do post them in the chat box and we'll get to those later on. My colleague Jenny is also going to put a link to a doodle poll in the chat box. She will pop it into the chat box now, and this is so that we can evaluate our webinars and to get some of the feedback from you. This webinar will also be recorded, and the recording will start now. That also means that this webinar will be available for you to view and share on our webpage. And again, Jenny is going to put the link into our webpage in the chat box, where the presentation slides will also be available after this session. So probably on Monday, if not before then. So just before we head into the presentation, I just would like Jessica, Nada and Femi to introduce themselves if you're happy to. Thank you.
Sure. Should we go in that order then? Hi everyone, I'm Jessica Arnold. I'm the Director of Flu and Covid vaccinations for South East London CCG.
Thank you, Jessica.
Good afternoon. I'm Nada Lemick. I'm a Director of Public Health in Bromley.
Hi everyone, my name is Femi Oshonga. I'm a GP in Southwark.
Thank you all. So with much further ado, I will pass it on to Jessica now, please. Thank you.
Sure, thanks very much, Lotta. Good afternoon, everyone. Welcome to this session, and very much wanted to echo Lotta's introduction there in terms of be thinking all the time about your questions, pop your questions in the chat. You certainly don't want to be listening to me for the whole time that we have together, so I'll start with some slides now. We'll hear from some of my colleagues as well, but really keen to have those questions. So as I mentioned, I'm the Director of Flu and Covid vaccinations for South East London. We've been working on the programme now for over a year, actually, including all of the preparation, and we've been vaccinating since last December. I'm going to start off with a bit of a review, talking to you about some of the progress and particularly some of the work that's happened over the last couple of months since we last had a series of these sessions. And I'm going to talk to you about the priorities and the forward view look now, looking into coming months and winter and beyond. So on the first slide, which is already up there for me, hopefully you can see this. So some headline figures, first of all. So I'm pleased to say we have now reached 2.7 million vaccinations given across South East London. And when I talk about South East London, I'm talking about the 6 boroughs of Bexley, Bromley, Greenwich, Lewisham, Lambeth and Southwark. So we're at 2.7 million vaccinations. We've given 1.4 million first doses, so at least 1.4 million of our population are protected with those first doses. And we've given 1.25 million second doses. There's obviously a bit of a mismatch there because some of the people who've been vaccinated quite recently won't have come forward yet for their second dose because they're not eligible, but obviously they will be after 8 weeks. We have also done, and I'm going to talk a bit more about the booster programme in subsequent slides, but we've done since the time of writing of the slides, well over 50,000 boosters as well for our population who are eligible for those. I wanted to say about second dose compliance specifically. So colleagues will remember, and members of this group will remember previous discussion around the importance of people coming forward for their second doses. We certainly didn't want anyone to feel that they could have a first dose, be protected and not bother with the second one. And I'm very pleased to say that we've seen, depending on the age group, between 97 and 99% what we would call compliance, so people coming back for their second dose, so that's been very positive. On capacity specifically as well, I wanted, oh, sorry, we appear to have gone on. Okay, sorry, on capacity, I wanted to say a little bit about this. So capacity is the total amount of people that we could be vaccinating, the total amount of appointments that we have across all of our different sites. In recent months, and again going back to when we will have spoken last time when there were some real shortages of vaccine, and you might remember where we had lots of people wanting their jab and not enough vaccine, I'm really pleased to say that we're not in that position now. We do have enough vaccine available, and therefore the waiting times for people going on the national booking system or being asked by their local GP practice or hospital to be vaccinated are very short. So that's really positive that we have lots of capacity out there in the system, lots of sites set up, lots of workforce, and we've got short waiting times. On the graph here, I've just broken down that 2.7 million by delivery model, so by the type of site that people can go to. The first one is primary care, so our GP-led sites, and you can see that primary care has done more vaccinations than any other delivery site or group of sites. Then our hospitals as well, also a lot of our people have gone to our hospitals, and then finally pharmacies. You may remember that pharmacies weren't part of the original rollout of the programme, but certainly we've had lots of interest across South East London from pharmacies, and I'm pleased to say we now have 48, I think it is, pharmacies that are able to offer vaccinations, so that's formed a really important part of the programme as well. Next slide, please. Thank you. So on this slide, there's lots of figures. I'm not going to go through all of them in lots of detail. Perhaps you work across all of South East London. Perhaps you work within one of the boroughs and live in one of these boroughs, so you can pick out what's of most interest to you there. I think if you look at the table overall, it demonstrates a couple of really important points. The first one is, you can see as we go down the age groups on the left side of the left part of the table there, that the uptake rate has been a lot lower amongst younger populations, and we've done a lot of work to try to increase that uptake. I'm going to talk a little bit about it, and I know colleagues are going to pick this up as well when we talk about the communications. But generally, we've seen better responses from the older age categories and lower responses from the younger groups. So something we're working on, very mindful of. Also, people with at-risk conditions as well. You can see on the part of the table to the right there that the uptake's been lower, and all of those people, some of those people will be younger people with conditions that place them at risk. And again, not coming forward in quite the numbers. We're not getting up into those 90% that we would want to. So that's for you, to make you aware in terms of how the uptake rate and the progress has taken place so far. Next slide, please. Thank you. So firstly, the evergreen offer. So we're calling it the evergreen offer because the concept is, and the commitment is, that no matter what age cohort you're in or what risk cohort you're in, no matter when you first became eligible, it's never too late. It's never too late to take up the offer of vaccination. So the evergreen offer is, sorry, a bit background noise there, if you could just stay on mute, thank you. The evergreen offer, sorry, is to ask people to continue coming forward for those first doses and for those second doses throughout this programme. Now, I'm really pleased to say that people are, even the people who've been eligible for a long time and have had, lots of thoughts on this, have accessed information or maybe not, who've not been sure, been nervous, had concerns about coming forward, are coming forward now. And even in the last week, we've had 12,000 people across South East London who came forward for their first and second doses still. So that's really important because we do want those figures that I showed on the previous page to keep going up. And what that means in reality is that more of our population are, of course, then protected, and we'll see less spread amongst South East London. The outreach that we've been doing related to this, and particularly thinking about the differential uptake amongst different age groups, amongst different ethnicity groups, amongst different affluence or deprivation groups, people of different incomes, has been quite stark. So we've seen some real variation in uptake, and the outreach that's going on in our communities, our sites, with our practices, with many of you on this call, voluntary sector organisations and others, has been ongoing throughout the summer. So we have been doing lots of pop-ups in different locations to make them very accessible to people. We've been offering walk-ins to people who wouldn't necessarily book in advance. We've had vaccine buses going around every borough that we have. Sometimes they're not always buses, it's vans or taxis, but we've been able to go around, and we've done lots of tailored communications as well, focusing on particular groups and particular geographies as well. Within that, we've had a couple of focus groups where we know the uptake is lower, and we've been trying to work specifically with those groups. Pregnant women is one of them. So we know the uptake amongst pregnant women is lower than it is for the general population of that age. And we've heard lots of concerns that have been raised with us. We've been working with the heads of midwifery and with our maternity services across our hospitals to make sure that there's accurate information out there, and that information is available to women and families to make that decision. So that's important. And we've done a targeted communications campaign as well to promote uptake and to encourage and give confidence to pregnant women to come forward. Very sadly, we have had a number of pregnant women in our hospitals with COVID, and even on ventilators and in very serious conditions, who have not been vaccinated or have not taken up the vaccine, and really keen to get as many pregnant women protected as possible. The other group is care home staff as well. So uptake amongst care home staff has been quite low in the earlier part of the programme, and we have responded to the government nationally, the outcome of the government's consultation and the mandate that all staff must be vaccinated to carry on working in a care home. So although that's not a South East London specific decision, it is a piece of work that we've been working with across our boroughs, across our care homes, and with those individuals to, again, similarly make information available to them, to encourage people and give them the confidence to come forward. So we are working with a group now that's getting smaller and smaller because people are coming forward for vaccinations, but really keen to make sure that our care homes don't lose staff. We don't want staff being lost from our care homes, and we do want the uptake rate to be very high amongst those staff. So we've been doing that, and particularly thinking about the winter ahead to make sure that we've got a good rate of coverage in our care homes. Next slide, please. Thank you. We've done a huge amount of work on inequalities. I know if you joined us previously, you will have heard a lot about this, and probably in other forums as well. So it's not just about increasing the overall uptake across South East London or across the population as a whole. It's about increasing the uptake and making sure people are safe and protected within certain groups. So the work we've been doing around health inequalities has been highly patient engagement driven. So we've done lots of talking to our different community groups, voluntary sector organisations, working with members of the community and people who have come forward to be part of some of that listening and engagement that we've been doing. A couple of things that we've heard that really come out as themes include people wanting to have a conversation about their overall health, actually, and not saying, well, you just want to talk to us about vaccination, but actually there's other things that we want to talk about as well. So people thinking about their general health and well-being and other conversations. So, for example, blood pressure and mental health and other concerns as well coming out in those conversations. So actually, we're all complex people, and it's not just about vaccination or that decision to be vaccinated. It's about wider health as well. We've also had a lot of conversations and been able to do some good work with community pharmacies as well. So more and more it's emerging that areas of low uptake previously, who have now got good community pharmacy provision, have seen lots of people going to those pharmacies. And it's partly because you don't need an appointment to go to a pharmacy. They tend to open for quite long hours usually, and you can just go in. But also pharmacies are generally quite a trusted source of healthcare advice and information. So we've had some real positives with working with pharmacies as well. And then much of the other work has been around our communications as well, and reaching out to people, and particularly as time's gone on, to those younger age groups to encourage vaccination amongst those groups as well. Next slide, please. Thank you. So that's a little bit about kind of where we're up to and what's been going on over the summer and over recent months. Thinking now through to the task ahead and the work that we'll need to be doing from September. We are, and it's called phase 3. So it's called phase 3 on this slide because we had phase 1 at the beginning, up to the beginning of the year, where we were vaccinating the really vulnerable people, and then we had phase 2, which was getting all the adults vaccinated by the time that we unlocked as part of the government's roadmap up to July. Now we're in phase 3. So phase 3, I'm very pleased to say that all of the sites that have been set up, so whether that's primary care led with general practice, whether that's pharmacies, hospital sites, our vaccination centres, they are all committed and able to carry on providing vaccinations for the next part of the programme. So that's very positive. It means we've got very good access points, but we've also got people who have been doing this for a while now and have drawn out lots of learning and got quite good tips. So that's positive. In addition to that, we've got 16 more community pharmacies, and thinking back to what I said before about the importance of community pharmacies, particularly in lower uptake areas, I'm pleased to say those 16 pharmacies, some of them have opened now, and many of them, well, all of them, sorry, will be live by the 25th of October, so that's positive. And those sites will be delivering Pfizer predominantly. So all sites will be delivering Pfizer. There'll be a small number that'll be delivering Moderna as well, and AstraZeneca is available where there's a clinical need for it, but we're moving away from that as being the vaccine of choice, and generally offering Pfizer. So on boosters and third doses, so we've been rolling out our booster programme since the 22nd of September across all of those sites, and anyone who's over 50 or in an at-risk group is eligible to come forward, but they're only eligible once they've got to 6 months after they've had their second dose. So the booster is for people who are now 6 months on, will potentially be losing some immunity from their first and second doses, and for them to come forward. Now in South East London, across those 6 boroughs, that's 1.5 million people. So when I started talking on the first slide, I talked about the fact that we've done 2.7 million people to date, so since last December. The amount that are coming forward for boosters aren't just a small amount that's being added on to the end. There's another potentially 1.5 million people. So we still are very much in the swing, in the full pelt really with the vaccination programme. Staff boosters in particular are being delivered at pace, and I wanted to mention staff specifically. It's not just, well, the hospital staff particularly were some of the very early people who got their first and second doses, and at the very beginning the gap between doses was 3 weeks, so a lot of people will have had even their second dose quite a long time ago now, but also many people who are social care as well, or potentially working in voluntary sector organisations who are performing a patient-facing or a client-facing type role will have had their first and second vaccinations quite a while ago. So staff boosters are important to keep those people protected. Similarly, care homes as well. So we're arranging visits to every care home to deliver boosters to those homes, and making sure that we're able to work through them, generally led by primary care, so by our GP practices. as quickly as we can. Similarly with housebound people as well. People who are housebound will be getting their boosters. That's being led by their GP practice. It does take much longer to get round, partly because of the nature of going to people's homes. Obviously, you've got to go to each home and speak to people, deliver the vaccination. But in the case of using Pfizer, you also have to wait there for 15 minutes for the observation period after a Pfizer injection's been given. So it is quite slow going around, but our GP practices are working through their lists of housebound people so that they also get their boosters. Now we're aiming to deliver our boosters rapidly. The government notional target is the middle of November, but actually some people won't have reached that 6-month mark that I mentioned by middle of November. So I do envisage that we'll be going through probably till the end of the year to make sure those people, when they get to the 6 months, and if they're in the eligibility groups, are able to get a vaccination. And I wanted to mention third doses as well. So this is where it gets a bit confusing. So although people have their first dose, then their second dose, and many people, there's about 1.5 million coming forward for their booster dose, there is another much smaller group of people who are eligible for a third dose. So this isn't a booster, this is a third dose that's given 8 weeks after the second dose, not the 6 months, but 8 weeks. And it's for people who are immunosuppressed. So this is, for example, people who are undergoing cancer treatment, have had organ transplants, people with HIV who have got a high CD4 count, people with autoimmune disorders, etc. So there's a group of people out there and they are eligible for that third dose now. So we are encouraging people to come forward, and of course our GP practices and our hospitals are calling those people forward for their vaccination after 8 weeks since their second dose. Next slide, please. Thank you. So as well as the booster programme, the forward view and phase 3 also includes vaccinating children. We've been vaccinating children who are over 12 for some time now, where they're clinically extremely vulnerable. So since August, those children have been called forward by their GP practice or by paediatric departments where they fall under their care for their COVID vaccine. Where children are housebound, then home visits are being offered as well, again with the earlier caveats around getting round all of those households, and that's ongoing at the moment. We've done a few pop-ups as well, where we've gone along to special educational needs and disability schools to vaccinate in the school, and that's being worked through. So those most vulnerable children are being vaccinated systematically and called forward. The much bigger group, bigger in terms of numbers and size of the group, are the rest of the 12 to 15-year-olds who are now also eligible and who will be made an offer to be vaccinated at school. So our schedule of school visits is now being finalised and actually booked in. I think 97% of our schools have now got a confirmed date for their vaccine, soon to be all of them. We've got 77,000 children in South East London who are in this age group, but we've actually got 85,000 children who are at school in South East London. So where those extra children have all come from is over our borders and coming into South East London schools. So we have a lot of children to vaccinate who are our own children resident here, but we've also got an additional chunk of children as well to be vaccinating who are in our schools, and there's nearly 200 schools, because this is being rolled out across mainstream schools, across private or independent schools, and our special needs schools as well. So that's ongoing at the moment. The visit started from the 23rd of September, so we've been going for about 3 weeks now. Obviously, because there's a lead-in time, we need to make sure the schools are happy with the dates they're being given, and the children need to have parental consent, and the school needs to make time in the school day. We have started with a small number of visits, and we are increasing the number of visits we can do every day and week. So we will be able to work around all of those schools by the end of November. We're also recognising that it's very, very important that every child gets that offer of vaccination in school, so that they don't have to be taken somewhere or go somewhere else in their own time, or their parents' or guardians' own time. We're committed to making that 100% offer, but also there will be a supplementary offer for those children or families who can go elsewhere and want to have their vaccination sooner, or very, very importantly, missed the school visit. So they might have missed the school visit because they were unwell on the day, because they'd recently had a positive COVID test, or because they changed their mind and didn't really want to be vaccinated in school. And we've got quite a high incidence of needle phobia amongst young people, not necessarily in South East London, but it's just higher than it is in the older age populations. That's important. It's also important that children who are homeschooled are able to go somewhere, so they obviously don't have a school visit, but they will be able to go to some of our larger hospital sites and some of our primary care sites to receive their vaccination. Parental consent is required, but it's not absolutely necessary. So if we have a child who is able and capable and wants the vaccine, then we'll be able to vaccinate them as part of that supplementary offer in our hospitals and primary care as well. And then finally, 16 and 17-year-olds, don't know whether this is right under the heading of vaccinating children, I suppose it is. So unlike the younger age group, 16 and 17-year-olds do not need to give to get parental consent. They can give their own consent. And we've been doing pop-ups at our sixth forms and our colleges. We've been doing some opportunistic jabbing as well, where there's been 16 and 17-year-olds in our schools or at our vaccination centres and sites, been calling those young people in. However, the uptake rate has been very low amongst this group, and colleagues leading on communications and engagement have been doing a lot of effort in recent months around targeting those younger age groups, reaching them through social media, telephoning them through our call centre, and of course they've all had letters as well. So the work continues to try to encourage those young people to come forward. And then next slide, please. So this is the final slide from me then. So this is really around challenges and priorities heading into winter, and I think I've mentioned most of these. So there is something about the inequalities aspect and population health. So a huge amount of effort and good work has been going on to encourage people to come forward for their vaccination, but we still haven't seen full uptake of first and second doses amongst all of the different groups. Pregnant women, I've mentioned, are part of that targeting as well, to encourage them to be vaccinated, as well as retaining our care home staff, given that it will shortly be mandatory to have a COVID vaccination if you work in a care home. Delivering boosters is a huge amount of the work, and I've mentioned all the people that are coming forward now, so that's positive. And then finally, just making sure that parental consent and the children's consent to be vaccinated, whether that's in their school or a different site, is promoted as much as possible, and that people have got access to reliable information, to have a conversation and to have their questions answered. So I think that's all from me. Lotta, is it back to you now? Oh dear, I don't know if you're there.
Yes, sorry, I am there. I said I just had to come out of the slides because I had a full screen, so I lost all my functionality to do anything. So let me get the presentation up. Thank you so much, Jessica, for that. That was really comprehensive. There's a lot to take on board. There's a lot of activity going on. And we are now going to look a bit more closely. I hope you can still see the screen, because this just allows me to actually use my laptop, which is really helpful. So I hope you can see the next slide. And through the work that we have been doing, particularly in the communications and engagement team, and also across the organisation, we talk to people on a daily basis, and we get to hear some of those questions that are frequently asked and that people express either concern for or they need information about. So we have tried to collate a few of those here just to sort of preempt some of those questions, and we'll try and tackle these and address some of these now before, as I said before, we'll have a Q&A at the end. So to start with, the first sort of three questions are related to maternity. And are some pregnant women more at risk of becoming seriously unwell from COVID-19 than others? And I believe, Nada, you will be answering this question.
Yes. Thank you very much, Lotte. Yes, I will. Are some pregnant women more at risk of becoming severely unwell? There is, unfortunately, generally pregnant women are at somewhat slightly more increased risk of potentially having a more serious disease. This is general. This is not specific to some pregnant women. What happens? The risk is higher in the later pregnancy, so possible complications could be to having a premature baby as well. Although I have to say that the actual infection with COVID hasn't been shown to affect the baby itself, but just the general pregnancy that women could have an earlier birth. But there are obviously, if pregnant women have other risk factors like general population, they may be at higher risk of COVID because of other individual factors. But as pregnant women as a group, they do have moderately increased risk of complications compared to other population groups.
Thank you, Nada. The second question is in relation to fertility, and we know that this is something that a lot of people have sought information about. So are you able to answer this?
Yes, yes, I can. There has been a lot, I think, information recently, and I hope that people could see the reviews done by both Royal College of Obstetricians and Gynecologists, Fertility Society. It's a lot of information. The short answer to this really is that there is no evidence at all that vaccination affects fertility in either men or women, and there has been studies that looked into that, and nothing has been. There is no even indication that could be the case, and really, even biologically, there is no biological sort of theory why would that cause problems with fertility. So the answer really is no. And there is a lot of information, and I think we could maybe provide links to. Really good. There is a website by the Association of Reproductive Medicine and also our College of Obstetricians and Gynecologists. They've got a lot of information that go into detail, so we may wish to maybe provide that.
Thank you, Nada. And the final question in relation to pregnancy is, will my baby be protected from COVID-19 if I have had both vaccines by the time the baby is born?
That is a really good question, and I think the jury is still out. We don't have sufficient data on that, but there was one study, I think, conducted in the United States. They've looked at the baby's blood, the blood cord, the cord that connects mothers and babies, umbilical cord, and they have found antibodies in that blood. So it seems that antibodies could be transmitted to the baby, but how long they last, whether they protect the newborn baby, it's a bit early to say, but it is possible. So this preliminary studies are sort of pointing towards that is a possibility. Yeah, but we will know more, I think, later as we have more studies on this.
Thank you, Nada. Thank you very much. That's very helpful. I think the next set of questions is for Femi to answer, and this is obviously in relation to the winter season being upon us very soon, and the talks of flu and COVID is again circulating a lot in the media and in the news. So Femi, are you happy to answer the question around do I need a flu vaccine as there wasn't much flu circulating last year?
Yes, yes, I'll answer this one. So, yes, you do need to have your flu vaccine, because what happens is that the flu virus changes its character every year. So each year they have to match each vaccine to the character of the virus we are facing for that season. So I will encourage everyone to please have their flu vaccine this year for that reason.
Thank you. And then that follows on to the next question, which is, can I have the COVID and flu vaccine at the same time?
Yes, where that is possible, that is what we are advocating. So it saves you having to come to the vaccination center twice. So where this is available, you should be able to have both of your vaccines at the same time. But where it isn't, then we'll then call you back.
Thank you, that's great. And who is eligible for the flu vaccine this year? Has the criteria changed?
Yes, because in the initial criteria, well, the age group has been extended now to 50 and over for people who have good health. So if you're over 50, you're like to be invited for your vaccines. And then for people who have chronic conditions of their heart, chronic lung condition, people who are immunosuppressed, they will all be called to come and have their vaccine. So that is what is increased. It's just the age range has been increased this year.
Thank you so much. I think possibly the next question is for Jessica. So this is around the timing. So when will I be invited for my booster? And I know you touched on this a little bit in your presentation.
Sure. So people will become eligible for their booster once they've reached that 6-month mark. Just to confirm what is meant by 6 months, is actually recorded on the IT system as being 183 days. So when you get to that 183rd day, you then become eligible. People, however, in terms of being invited, so letters are going out to people. GP practices are contacting people, whether that's through text message or another route, and hospitals are also contacting people, but it might not be on the day that you're eligible. So you can go onto the national booking system, and that will give you all of the appointments that are available for booster doses in the local area. So then you'll have the choice of whether you do go to a pharmacy or hospital or hold on for your GP practice. But just to manage expectation, really, we are delivering flu and all of the usual business as usual, and all of the care homes and housebound at the same time as well. So don't worry if you think that you're past that 6-month point, but you will be invited in. And in the meantime, if you've got internet access, you can go through the national booking system as well. The booster vaccines that are being given are Pfizer for people who have Pfizer first time. And Femi, you'll tell me if I'm wrong on this, because obviously you know better than anyone. People who got Moderna first time, I think, are being given Moderna, and similarly with AstraZeneca as well. So it generally does follow the same pattern. If, however, there was some reason why you might have to have something different, if you had a bad reaction, then that would be considered. But for most people, it would be the same.
Thank you, Jessica. That's helpful to know. So are you happy to address the last two questions around?
Oh, yeah, sure, no problem. So Pfizer is being given to teenagers, so those people aged 12 to 15 as part of the schools programme or the wider programme. We are giving Pfizer to young people, and if someone misses their vaccination at school, so as I mentioned before, there is that supplementary offer, so it's not just available in schools. Now we'll have details of that, and go online and have a look at our Grab a Jab website, because from Monday we'll be able to put all of the details of the sites. We are going to have particular clinics set up that are targeted at young people who are 12 to 15 at St Thomas's Hospital, Lewisham Hospital, Bexley Civic Centre and Bromley Civic Centre. There'll also be additional sites to that. We're just working through those, so I haven't named them now because we're setting this up at the moment. And we also have an agreement across all of our primary care sites and our hospital sites that if there is a young person there who wants to be vaccinated and they're eligible and there's no reason why they shouldn't be, to go ahead. So that's not we want anyone just turning up, because obviously lots of these sites aren't walk-in availability at all, but it does give that assurance that people shouldn't be turned away, and that it is quite a flexible offer.
Thank you, Jessica. Okay, so we will look at the questions in the chat box very shortly. I will just run through a couple of bits just to give you an update on what we've been working on. And as you already seen from the presentation, there's been a huge amount of work going on. And both the central team and our borough teams are working really, really closely with lots of different community groups and in the community to continue to support the vaccination campaign. We are also specifically developing, or we have done, campaigns to target the different groups as well, because we understand that the message for pregnant women and for teenagers and so forth have to be tailored and slightly different. We're also we're also launching a microsite, and this has been developed in partnership and it will be ready for next week, and we will obviously make that site available, which will have lots of information, particularly aimed at younger people. So do look out for all of those things, and I know if you follow us on social media, you will always be up to date with the latest campaigns and what we're working on and so forth. And I would also ask you to, if you're not already linked in with your local borough from the CCG, then do so, because that's a really good way of working with us and try and disseminate the information so we can reach everybody in our community. So really, ask of you, really, it's around, you know, hearing what you hear today, knowing where you can go and find the information. Do make sure that this is accessible, and spread the word, spread the information. The more reliable sources that people are able to tap into and get information from, the better. And also do advertise any of our pop-ups. You can, if you follow us on social media, you can then share our posts to make other people aware of what's going on with regards to the vaccination programme. And obviously right now we're very, very keen for people to come forward for their booster jabs, and also for those who may, for whatever reason, not even had their first or second jab, you know, to encourage those again to come forward, reach out, speak to us, speak to people in the community, and get the information so they can make an informed decision. Right, I'm just going to stop sharing my slides for a moment so I can have a look at the chat box, because I've heard my phone buzz a few times, so I know there are chats in there. So just bear with me while I find the questions here. So just a reminder of the do poll as well. I will send this out on email again, just to ask for your feedback. Okay. So we have, I will just go through this in order. So hi, so this is from one of our guests from AGK. Kindly confirm vaccination figure as a percentage population. Sorry, I'm trying to read it. Kindly confirm vaccination figures as a percentage population eligible vaccination. Jessica, is this something around eligibility? I can't quite work out what.
Yeah, so I think this question is around how many people are coming forward who are eligible. So I'm just going to share my screen now. So this is one of the slides we showed earlier. So just for that person who I appreciate might have just missed it. So if you look on the bottom row here, this is South East London, but you might prefer to look on a borough that you're particularly interested in. And what it shows is the percentage of those people who are who have been vaccinated, who as a proportion of the total eligible population. So 90% of our 80-plus-year-olds have been vaccinated, only 40% of our 16 and 17-year-olds, and everyone else is falling somewhere in between. So I think that's what the question's trying to get at.
Yeah, do call out if we're misinterpreting your question in any way.
Yes.
I know, Neville, you have put some questions in around over 18, so over 12. I'm not quite sure what you mean by that question. So conversation about side effects in COVID-19 vaccines. Again, Neville, I'm not sure how you want to pose that question. So looking through the chat box. So do we know the impact of COVID-19 on how many, if any, of those having had 2 jabs have been on ventilator, and how many have died? Is that information that we have to hand, Jessica?
And I put Nada on the spot for this one in terms of some of that data coming through.
Thank you, Jessica. We don't have the full data on that yet. What is happening, because but patients in hospitals and unwell, often the hospital teams don't know whether they have been vaccinated or not. To be able to have that, you have to link the hospital data with the primary care data. And the Public Health England has been involved in a study to link those 2 data sources, so that we will be able to know actually what proportion of people who have been vaccinated had, as you suggested, been in ITU or had died. what we do know that there are some people who are not, I can't give you the figures, but we know that there are people who have been double vaccinated and who have had a poor outcome and potentially died. We have to remember that vaccines are not 100% effective. They're around, let's say, 85% effective. So even if we vaccinated 100% of people, there will be people, let's say 15 or whatever percent, who will get severe disease and could die. So that is unfortunately, as because vaccines, as I said, are around 80%, 85% effective. And actually there is a sort of a paradox in a way. As we have more and more people who are vaccinated fully, the people who are in hospital, proportionately from people who are in hospital from COVID, there will be more of those who actually have been vaccinated. Because if we vaccinated 100% of people, then only those who will be ill will be only those vaccinated, if you follow what I meant. So that is a situation with the vaccine, as it's not, no vaccine is 100% effective.
Thank you, Nada. I think that covers the question from Neville as well. So I will move on to a question by Marilyn, which is around the effects of multiple flu, COVID, boosters, shots, etc. So I guess having multiple injections on systems of people with additional health needs. So I don't know if Femi or Nada wants to answer that. So this is around having both flu vaccine, COVID vaccine on I guess the clinical impact. Thank you.
Shall I start and then maybe Femi can add? The data, research data, is not showing that there is any effect on this type of vaccine, flu and COVID. They are not live vaccines, so these vaccines, so giving them together and or in sort of multiple vaccines wouldn't have effect on health of the population. There are side effects of giving vaccines, like we know, side effects on the side of sort of a local site of the vaccine, like, if you've got a pain on the vaccination site, so side effects type of thing, fever, feeling unwell. That is the case with all vaccines. Yeah.
Thank you. Femi,
yeah, so I quite agree with that. Now that I just put it nicely. So we'll encourage people to do that because they're not live vaccines, and it's safer for you to be vaccinated with the two, okay, and then get it done. Because if you are to be ill, either with flu or with COVID, and you have underlying medical condition, definitely your risk of hospitalization and serious illness is higher. So please encourage people to have their vaccines, and they can have the two safely at the same time. Thank you.
Thank you. That's very helpful. We had a question around the 6 months, but I think you clarified that, Jessica. You said it was 183 days for your booster. I will look at those questions that we particularly have not addressed already, just to make sure that we have time for additional questions. So does the vaccination and dosage vary according to age? Who could potentially answer that?
So for COVID vaccine, no, you don't get a different vaccine depending on what age you are. For the flu vaccine, then you do. So people who are over 65 get a different vaccine to those who are under 65 in an at-risk group. But that will be known by the people vaccinating them, and they'll get the correct vaccine. It's the same every year. It hasn't changed this year with flu. It's always a different vaccine for over 65s compared to unders.
Thank you, Jessica. We have a question from Lucy, and this is around people being invited for their booster and they booked it online, but it's a few days before the 180-day mark. Can they still have it, or should they be asked to rebook? So the sort of that cutoff of 183 days have passed. So if people have been able to book their booster, can they still go ahead and have it?
Sure. I mean, this sounds like it's coming from a health professional some site, and I'd like to pick it up separately because my understanding of the national booking system is that you can't book it before you get to the 180 odd days. So if that has happened, really happy to look into it. But generally, We have been given that as the cut-off. It certainly wouldn't harm anyone, given that it's a 6-month gap, to have it a few days early, but it would depend on what they're able to do at the site. But if it's been booked online through the national booking system, I do wonder if that's an error, because it shouldn't have been. So hopefully they were small numbers that did come forward if that was the case, but really happy to pick up specifics outside of this.
Thank you, Jessica. We have a question from Marilyn around whether or not GPs always recommend a COVID vaccine for people with autoimmune disease, or it's in various sort of cases.
Yeah, so my advice would be for people who have autoimmune disease to have their vaccination. The reason being that if you become very unwell, because your body is fighting on various fronts, trying to suppress the autoimmune condition that you are going to, you might become very unwell. But particularly for people who might also be on medications to try to suppress the autoimmune disease. So a lot of people will be on long-term steroids. Okay, that can also affect your immune system in a way. They might also be on immunosuppressant drugs, that is drugs that are actually fighting trying to suppress the autoimmunity that they have. And all these things put a lot of load on your immune system. So the advice would be to please have your COVID vaccination.
Thank you, Femi. And perhaps, I don't know if it's you, Jessica, if you can just clarify again, will GPs or the NHS contact people by letter for third dose booster, or by letter, even if they received via pharmacy or other route, if not at the surgery,
Sure.
if the first doses?
Sure, absolutely. So the NHS centrally is sending hard copy letters out through the post to people who are eligible. So that's going on, and GP practices will contact people who are registered with them, who are due their whether it's a third dose or a booster, regardless of where those people went the first time. And that generally won't be by letter necessarily. It might be, but it generally be by text message or another route. So, so yes, they will hear even if they went to a pharmacy.
Okay, thank you, Jessica. We have a question here from Neville, which is around contracting COVID despite having 2 doses. So we know that that can happen, but he's asking, is there any data of those who've had the booster and contracted COVID in the South East London area?
Shall I start, man? And I think it's too early, yes, for that. So we've just started giving boosters, so unfortunately not. As I said earlier, Public Health England is conducting this long-term study where they're linking this data from earlier days for people who had vaccination and linking it to their health records to see what happens to them. This is part of the surveillance of vaccine to make sure that vaccines are safe. So people, obviously, after people will have boosted, this will be also in their health records. So eventually we will know, but it's a little bit too early yet.
Of course, thank you. I think that is all the questions that's been posted in the chat box. So if there are any other questions, we're happy to take those now. If someone wants to ask a question verbally, that's fine as well, or you can put your question in the chat. So if you want to ask a question, you can either just take yourself off mute, or you can raise your hand through the little functionality on Teams.
I think there is an additional question in there now, Lotta.
Okay. All right, thank you, Jessica. Oh, indeed, yes.
Yeah.
Sorry, I've just got to read them quickly. Are primary care and the NHS site linking vaccine status to prevent people being contacted multiple times to get their boosters?
I'm happy to take this one. So when you get vaccinated, the record of the vaccination goes into your medical record very, very quickly. Usually, I wouldn't say instantaneously, but it's the same day, so it's very quickly. So you shouldn't be contacted once you're vaccinated. And certainly the way that GPs call in people, they will run the latest list of vaccinations that have been given and obviously not invite people who have already been vaccinated. Having said that, letters that come out from the NHS centrally, for example, obviously there's a lead-in time to get those letters printed, enveloped and posted, so you might be sent a letter when you've been vaccinated already, and sometimes it does happen that the lists don't quite match up, so you'll get another offer. But actually that's not a bad thing. It's better to offer someone when they've already had it than it is to miss people out through a less robust process. So generally, yes, it's in your record, so you shouldn't be invited again, but sometimes people do because of some of those factors in getting so many invitations out to people.
Okay, thank you, Jessica. Do we know something about if the booster or third vaccine will appear on the COVID vaccine passport on the NHS app? Do we have any information on that?
No, we don't. We haven't received any information unless NARDA's heard anything separately about this. I don't think. No, I don't think we've been given any instruction around whether there's any national plans to add that to the NHS app, COVID Pass. So we'll find out soon, hopefully. Okay,
thank you. There's also a question around, which is not directly related to the vaccination programme, so I'm not sure whether you do have any information, but it's around the PCR tests and the things that's been circulating in the media about them not working properly. So Nada, do you have anything that you might be able to share?
Well, not very much apart from what we've been told, that this is a laboratory in Southwest, so it's not affecting us in London and around London, but it is not as yet clear what the problem was. So apparently patients had positive LFD tests and then negative PCR, so there obviously was a problem, but what that problem is, I don't know.
Okay, thank you, Nada. So I can't see that there's any more questions at all. Oh, we have a hand up. Let me see if I can see your name. Let me just see. I can't actually see the names now. Let me just bear with me. Oh, it's Van Jiao. Do you want to ask a question? Oh, you're on mute. We still can't hear you, I'm sorry. Oh, yes, we can hear you.
Yeah.
Sorry about that. Now, this question is for Femi and Nadine, please. It's about multiple vaccination. Now, I do not understand whether the age group here, will you be vying for age group here, or it doesn't matter really when it comes to this?
So the sound is a little bit hard. Can you just repeat what group are you talking about?
Yes, I was talking about the multi vaccination. Now, Femi said that there's no effect on vaccination. Now, my question is, up to what age can this lead to, if you like? And does it go down the floor, down the ground? That any age doesn't matter, even if they have multiple vaccination, if you know what I mean? Do you understand what I'm saying?
You're just on mute there, Femi.
So please do correct me if I'm wrong. What I understand from your question is about multiple vaccination. And in this context, we are talking of people having the flu vaccination and the COVID vaccination. Is that what you're saying?
Yes.
Yes. So what's the question regarding that?
The question here, does it matter age group? Any age can have multiple vaccination.
Yes. So yes, any age group can have multiple vaccination. So in this case, yes, any age group that is eligible for this can have multiple vaccination. And if I take it out of the COVID and the flu vaccination, so in children, for instance, when they are born, when they come to us, we give them multiple vaccination as part of their childhood immunization. So it is safe in this context as well for them to have that, irrespective of their age group.
Well, thank you very much. The other question is, if I may, please, going back to fertility section. A lot of people have been very much affected by this psychologically, if you like. And many have come to me saying that since they've had vaccination, or whether this is just their own myth, they say that their sexual the sexual reaction has gone down. So I'm not sure what to answer to these people, please.
Nadash, do you want to take that?
Shall I start? Yeah. Generally, looking at the population and the side effects, this is not something that I have heard. I have looked at a lot of studies and lot of sort of research, and I haven't. There is at least I haven't seen any evidence of that. I think sometimes when you look at, and that's important also to recognize, when you're looking at individual people, we as individuals often have things happening to us that would happen in any case, regardless of, let's say, vaccination, or regardless of, I don't know, maybe some other medical treatment you're having. So sometimes at individual level, it's difficult to link this to, particularly if there is no evidence elsewhere that this is the case. So I would say that from my knowledge, this is not linked, and it could be coincidental, but it could be that, you know, a person might have other issues in their life, might have all kind of individual side which could cause some of those problems.
Thank you.
Thank you, Nada. Is that okay? Shall we move on to Linda? You have your hand up.
Thank you very much. Thank you.
Thank you. But Linda, you're on mute.
There we go. Can you hear me?
Yes.
Hello. I think this
Yes.
might be for Jessica. Peter and I, my husband and I, are constant volunteers up at the Civic Centre at Bexley Heath. And we were actually amazed at your putting us forward for the younger vaccines. Brilliant. We love it. But are these vaccinations going to be kind of out of school hours, or they're going to have to come out? Because we know that we've been told that a big local school is not offering the vaccination, so they'll be coming up to us up there. So this will mean the knock-on effect of needing more volunteers. We really do need it after their school hours, or Saturdays or Sundays.
Sure, absolutely, really good question. So the additional offer to be vaccinated outside of the school premises is also outside of the school hours as well. So exactly as you said, evenings and weekends. Now, I'm not aware of any schools, certainly not in the Bexley area, that have said that they're not having vaccination on site. Actually, we've got dates in for them, so that's a little bit worrying. So I'm very happy for you to contact me separately and let me know, and I can follow up and find out when the date of that school is. But certainly we're working through all of the schools, large and small, of different types, and they do have dates in. Now, some of them don't have dates in immediately. It will take a couple of months to work through. So I mentioned previously that they might have a date later in November, in which case they might very well prefer to come up to Bexley Civic Centre or somewhere else because it's sooner, but they should all have dates in. So yeah, please get in touch. Thank you.
Yeah, thank you very much.
Thank you, Linda, for your question. We do have a question in the chat as well from Christina, which is, can I confirm if you're under 50 years old and don't fit into any of the categories, you do not need a booster or third vaccine?
Correct.
Perfect. Thank you so much. Thank you. I don't know if there are any other questions. I can't see any more questions in the chat box. I'm just going to put a link, or actually my colleague Jenny has just put a link into the chat box on this web page, which is a page on the South East London CCG's website. You will find the recordings from our previous webinars, particularly on maternity, fertility and pregnancy that we ran in August. We're also running one, so if you're specifically interested in that area, we are running another webinar like this on Monday evening at 6 o'clock, and the details are on that web page. And the recording from today and the recording from next week will also be available on this website. So do check back on this website regularly, because we will put all the dates on there and all the slides and the recordings as well. So bear that in mind. That's a really helpful way to keep yourself up to date and get the latest information. So I just want to reach out one more time to see if we have any other questions, or do let me know if I have missed anything in the chat box at all. Otherwise, I think I would just like to thank everyone for their time, everyone who participated and dialed in, and to Jessica, Femi and Nada for your time, and to Jenny and Sarah for supporting us. And thank you very much. Do look out for further information, and thank you for everything you do to support the vaccination programme in your communities. Thank you.
Thank you. Bye.
Bye-bye. Thank you.
Bye.
How do I contact Jessica? How do I contact Jessica?
Linda, send me an email. Have you got my email address?
Yeah, I think so, yes.
Okay, contact me and I'll put you in touch.
Thank